All right, Dave from Align Therapy here. I'm here with Sammy, who's going to be my model for a scoliosis correction exercise that we use in the clinic a lot. First of all, I want to show you where Sammy's curve is so you can tell kind of where her scoliosis curve is. And then we're going to talk about how to build awareness of what that curve is doing to your posture and how we fix it in fix the posture, not necessarily fix the scoliosis, with an easy correction. So first of all, Sammy sits usually very straight anyway. It's her dance background. She usually sits, shoulder blades are moving here. She usually sits very tall. So Sammy, show me bad posture. Is that all you got? Okay. So we have a little more of a forward position. You can see her spinous process poke out a little bit on a few spots because she's rounded back like this. I don't know how often Sammy sits like this, but we'll consider that not ideal posture. It's not necessarily bad posture because she's still in a decent posture. So first of all, sit a little taller. If you look from the back, you notice Sammy's shoulder blades sit a little bit different. So this shoulder blade, you can see more of the tip of the shoulder blade. And it's sitting a little more forward. The bottom of the shoulder blade is sitting more forward. This right shoulder blade pokes out a little bit more, and her shoulder actually sits a little more forward on the top, the tip of the shoulder up here. That's because her ribs on this side, she has a curve that goes to the right, and her spine is rotated this way. So the right side is back, put that back. The right side is back, and the left side is forward. And that's what we notice the most about the scoliosis that Sammy has. So she has a right-sided thoracic curve. So knowing what's going on with the shoulders, you can kind of pick that up in the mirror on the front. Sometimes it's hard for the person with scoliosis to see that because they can't see their shoulder blades. But you can see your shoulder, and so with Sammy in the mirror, maybe she can't see it as much, but that right shoulder sits a little more forward. Left shoulder sits back, this shoulder blade wings a little bit, and we see the ribs rotated back here and forward here. So the first thing is I want you to build an awareness of what your scoliosis is doing. So sitting in front of a mirror is helpful, and looking to see what is happening. Which shoulder sits more forward, which shoulder sits higher, which one sits lower, being aware of where your waistline is if you're shifted to the side or the other side. All those things indicate where the scoliosis is and how it's affecting your posture. So you have to be aware of that before we can actually address that or do anything with that. So then, after you know what's going on, there is a technique called the SEAS approach, the scientific exercise approach to scoliosis. It comes out of Italy. And what we do with that is we start to reduce the imbalances that we see. So once you're aware of how the scoliosis is affecting your body, then we try and correct for that. So this is something I don't want you to do at home. This should be done with someone that's trained in the SEAS approach, in the Italian method. But I'm going to show kind of some of the principles about it so that you can have an idea of how it's affecting your posture and some things that we do about it. So the first thing we do, she's already sitting up nice and tall, perfect posture. Hands just resting on your lap there. So if she was shifted to the side, if she had a different scoliosis curve and she was shifted like this, so that feels totally abnormal to you, but stay there for a sec. That is actually a very normal scoliosis curve to see. We would correct and center the pelvis. But since most of what we see with Sammy is the rotation, we're going to correct for the rotation. We're going to de-rotate the spine going this way, and then if you notice her right shoulder goes with it, she wanted to correct it because she knows what we're doing. We're going to bring that right shoulder back so that she's square with the mirror and that her head is square with the mirror. So we've taken this area of the spine, de-rotated it, and brought the shoulder blade back. And then I'll usually have her do some exercises associated with challenging her ability to control that. So right now we don't see as much rotation in the spine. Her shoulder blades are pretty symmetrical. This one's still a little bit out. but she's really derotating those ribs. Go ahead and relax. So when she relaxes, we see that rotation come back into play. So all those things are important for her to be aware of, because once she's aware of them, then she can do something about them. If we don't know what's going on, it's really hard to do something about it. So your homework, if you're watching this video and you have scoliosis, build awareness of what's happening in your body. Build awareness of the asymmetries that are happening. Don't pick yourself apart, but be aware of what's happening, and that will help you as you get into scoliosis specific exercise. So hopefully that was helpful. Thank you, Sammy, for helping us out, and have a good one.